Burnout. We're going to get a count and figure out how many people are here tonight, because I think we're going to hit 1,000 people in Maine pretty soon who've heard these messages from students, from teachers, in these kinds of contexts and settings, because it's an important topic to talk about. So I'm Jane Disney, and I'm the education director at MDI Biological Laboratory. And I had a dream that we would get a lot more wells in Maine and New Hampshire sampled for arsenic, because it's such a huge public health issue. And that's what you're going to learn about tonight. I'm not going to tell you all that much about arsenic or about that public health issue or what the mitigation strategies might be, because the students have done a lot of research. We've got students here from Waterville High School, right? Waterville High School?
Waterville, let's hear it.
We have some students here from the Maine Academy of Arts.
Right? Maine Academy of Arts, what's up?
Yeah, we have representatives here from the Maine Academy of Natural Sciences. Yeah. Mm-hmm. We have Colby College and, right? Colby College students. And then we also, have the teachers here who've been working with these students and making all of this happen this year. So we have John Ramgren and Justin Giroux from Waterville in the back. We have Kenlyn Clark and Susie Bright here from the Maine Academy of Natural Sciences. I always say it wrong. And then, interestingly, we have Tom Klepak here because he's playing a dual role in this project. He actually is an instructor over at the Maine Arts Academy, but he's also a professor at Colby College. And all of these schools, and I'll be telling you more about this, they are working with a scientist partner. All the schools in Maine and New Hampshire have a scientist partner from a nearby college, and then here in this area, it's so Tom has taken on trying to help teachers and their students grapple with arsenic data as it's come in and think about questions that they need to ask, and then also to help move them toward this night so that they can communicate their science to people who are interested and know they need to hear these. So the name of the project is Data to Action, a secondary school-based citizen science project to address arsenic contamination of well water. And I'm here with my project coordinator, Anna Farrell, in the back. We drove down from MDI today. And we actually have one of the project external evaluators here, Bill Zulick, and he's from Skutik Institute. So he's just going to watch and learn from how the whole process goes and what everyone's taking in. So I'm going to refer back to this, and you're going to see it happening tonight, this data to action concept. All of us coming here tonight, that's the first step of the action part of this project. Because the students have been collecting water samples, they've been playing with data, they're trying to understand what's going on in their communities and comparing that to what's going on around the state and the region. And unless they can convince you and their families and neighbors that if there's a high arsenic level, something needs to be done. And if there are barriers to getting that thing done, like it's expensive to deal with or whatever, the students are thinking and problem solving, and they have some ideas, they've run some experiments, they've got some things to show you. And maybe they can move us all the way to addressing the problem in our well. So you may have seen this map before if you've been on our All About Arsenic project website. This is actually from the USGS, and it kind of highlights for you the problem we have in New England. So you can see that some of the highest arsenic levels in the country are right up here. And I can tell you what is also happening in New England. We've got a 20% higher incidence of bladder cancer than elsewhere in the nation, and it's directly attributable to exposure to arsenic. And I think the students have other things to share with you. I don't want to steal their thunder and all of the things that they've done and researched, but This map is kind of self-explanatory in terms of why this project, why here, why now. So in case you didn't realize, there's a huge reliance on private wells. I know some of you are probably on Waterville public water. How many people are on a public water system here? So not such a big problem for people because who are on public water, because you're not allowed to have arsenic in a public water system. But as you can see, 56% of the people in Maine and 46% in New Hampshire are reliant on private wells. So even if it isn't a problem for you, it's a problem for someone else at your school. It's a problem for someone else who's living on the outskirts of your town. And they need to hear this message too. And then when you look at the wells with elevated arsenic, you can see that a good 10% of them in Maine are above this 10 part per billion level that the EPA has set, and 20% in New Hampshire. So New Hampshire has a little bit worse problem. But this is only based on the wells that have been tested so far. And when you take a look in certain communities, you find out like maybe 30 wells have been tested. But there's like a couple hundred of them in that community. We have a little town called Tremont out on the edge of Mount Desert Island, and over the last decade there were only 30 samples taken. And the students went home one night and took another 30. And they doubled the sample size of the data set in Tremont. And next year, if we add another 30, we're going to cover that community over the 5 years of this project. So in Maine, you can see 42% of the wells, as far as we can tell, have never been tested. Or the Center for Disease Control has no data for 42% of the wells. That's a lot of people living in potential risk. And then in New Hampshire, they don't even have a good handle. How many people don't have their wells tested? We have a pretty good Center for Disease Control here. They operate under a different system in New Hampshire with the Department of Environmental Health Services, and so they don't have all this data at their fingertips. So this project is called a SEPA project. So you'll hear some of the students, you'll see on some of the posters, we use this term SEPA. I call them SEPA teachers, SEPA scientists. And it stands for Science Education Partnership Award. And I've been trying for a number of years to get one of these, and they're hugely competitive and difficult to get federal grants. And I'm super excited that we have one here now and that it's completely devoted to arsenic. So there's these elements of this project. You'll see from all the graphs on all the posters in the back and the data that the students present to you that there is a focus on data literacy here. We're really hoping that, being that arsenic is such a big issue and the data are so relevant in these communities, that the students will really be excited to explore the data sets, and at the end of the day, they're going to learn a lot about how to look at data and think about data, draw conclusions, make decisions, and move data to action. So the public awareness piece, of course, is really important. That's what tonight's about. The public health data. If any of you registered your water samples with your student, or the students who registered their own water samples, there was the opportunity to check a box that said it's okay to share this data with the Center for Disease Control. And so the data the students have collected are going to be part of a larger state data set that's going to help inform the Center for Disease Control on all kinds of public health fronts. Network building is really important. I'm excited to have teachers and scientists finding each other and forming partnerships that I hope last long after this grant is over. And then this STEM education that's inherent in a project like this, science, technology, engineering, and math education. I mean, I'm hoping a few students are jazzed enough after this to want to pursue science careers. So we're looking all the way out the other end to students who might decide, heck, I'm going to explore some summer internships at the state of Maine, or I'm interested in a college major in science, or I want to become a scientist, or a public health official, or a medical doctor. There's just so many aspects to this project that could call a student into any of these careers. And then at the end of the day, and I'm not sure we're going to get at it in this grant, but I'm looking at other funding opportunities to do the kinds of surveys that it'll take to find out if people really treated their wells. We're hoping for this community change piece. that we don't have people exposed anymore. I don't know that yet. All I know is that the students took the samples, they got some data, they're sharing it with their community, and then we do want to track at some point, did it make any difference? I would hope we could go from one end to the other in a project. So just for a little bit of perspective, these are the areas where we have commitment from teachers and commitments from scientists, and you can see that they're all around the state, but there's areas that we still need to work on, like up at Fort Kent and Presque Isle. You may be aware or not that MDI Biological Laboratory is actually the lead institution in the state of Maine for what we call an IMBRI grant. And IMBRI stands for the Idea Network of Biomedical Research Excellence. There's 23 IMBRI states in the United States, and Maine is one of them. And IMBRI states get extra federal funding to help build up the biomedical research infrastructure in the state because we don't have as much as other states. And so as a lead institution, we're working with the University of Maine system, with Colby Bates and Bowdoin colleges, College of the Atlantic, Southern Maine Community College, to try to increase the opportunities for research training for students interested in biomedical research. And so most of the scientists that we're drawing on here are part of an IMBRI network, either in New Hampshire or here. So we've built this whole project on this IMBRI network, and National Institutes of Health is pretty excited about that. It's like we're leveraging one project with another. And just so you can appreciate what teachers have had to do, because I don't know if the students are going to tell you this, they had to, both the teachers and the scientist partners had to attend training up at the MDI Biological Laboratory, and then move into implementing a citizen science project that involved well water monitoring in their classroom. So after collecting water and making their graphs and maps and doing their analysis, hosting a community meeting, that's the flow of the whole project. That's what's been going on all year, and here we are at the end of the flow chart. We had an EPA grant that was a pilot for this project. I think it helped us get this grant from NIH, but over both projects, you can see where we've reached in the state and where we haven't. So these purple dots are where we have a well water sample in this project. And so we're getting at 1,000 samples at this point. And the students have been working with this data set. And these are just some averages. They don't tell you anything about variation around that mean, but it gives you the sense that there's more problems in some communities than others. Waterville isn't the lowest average in the state. It isn't the highest. The Blue Hill Consolidated School is going to have a community meeting next week, and don't they have a lot to talk about, right? Those kids, they picked up, I don't know what the percentage of samples over 10 parts per billion, but a number of them are in the 200, 100 per billion. So they're having some serious conversations in that community. So later tonight, if you want, we're going to have a station set up in the back. And if you haven't already gotten your well water results from your student, you just haven't had the opportunity, then you can type your sample number, if you know what it is, into the All About Arsenic Project website, and your individual data set will pop up. You can take a screenshot of it, email it to yourself, photograph of it with your phone, or I don't know if we have a printer set up. Yeah, so maybe you could print out a sample if you don't have it already. Over in New Hampshire, they have this amazing website that you can type all of your water results into, and it's going to tell you what it means. But we have information like this on the All About Arsenic site too, if you're just looking for some quick access to what do all of these numbers mean. But I can tell you, if you're over 10 parts per billion arsenic, you want to think about what to do. And I could entertain a couple of questions, but I'll be around all night too. I want to get to the student. But I wanted you to have some context and framework for what they've all been involved in. It's a big deal. So there's like 113 SEPA projects around the country, and only 3 of them are citizen science projects like this, where students are really trying to move the science into their communities. It's a big deal with it.